Hello everyone, I'm Pharmacist Michael, and today I'm going to talk about sertraline, which is Zoloft, and whether you should be taking antidepressants, specifically SSRIs. Why am I even talking about this? Well, as a pharmacist, I believe that medications should only be used if other treatments are ineffective. And I know there's some conditions where drugs are necessary. But the reason for this is simple. If you're suffering from depression, I think it's important to at least try cognitive behavioral therapy before you go to medications. And take other steps to try to make yourself happy by changing your thinking. I've done several videos on this, and you can find them under the Mindset playlist of my YouTube channel. Gratitude, journaling, meditation, eating whole foods, exercise, yoga, and Tai Chi are just some of the things that you can do to help your mood before jumping to antidepressants. Why is this important? Because all drugs have side effects. But in this video, I'm going to go through some of the side effects of sertraline and other SSRIs, things you might not know. So let's get back to Zoloft. Zoloft is an SSRI, as we have mentioned, which stands for selective serotonin reuptake inhibitor. In the year 2020, Zoloft was the number 12 most prescribed drug in the United States. And it was also the most prescribed antidepressant. Zoloft is often the first antidepressant prescribed for both depression and anxiety disorders. We often use SSRIs first line because of their efficacy and tolerability. And most importantly, it's harder to overdose on these medications than it is other antidepressants. And of course, we're always worried about overdose in patients who are depressed. So how do they actually work? Well, we know that they stop the reuptake of serotonin back into the neuron, and this causes more serotonin to be available in the synaptic cleft, which causes more serotonin to be available to interact with the receptors. But we also know this isn't the whole story, because reuptake inhibition occurs very soon after SSRIs are started, but the full effects of SSRIs usually don't appear for 3 to 8 weeks after treatment begins, which suggests there's more to it than just the reuptake of serotonin. Probably has something to do with the receptors themselves, but we don't know for sure. It's important to realize that serotonin doesn't only affect mood. It also has effects on the GI tract, the sleep cycle, breathing and heart rate, and blood clotting. Serotonin also has an effect on libido, and too high of levels of serotonin can actually decrease sexual desire, which is one of the side effects of antidepressants. So let's get into some of the most important aspects of this drug. First, Zoloft has a black box warning, and this is what it says. Antidepressants increase the risk of suicidal thoughts and behavior in pediatric and young adult patients in short-term studies. Closely monitor all antidepressant treated patients for clinical worsening and for the emergence of suicidal thoughts and behaviors. So this means that Zoloft can actually make depression worse and can lead to suicide, especially in younger patients. I'm not saying this is going to happen to you. I just want you to be aware of the risk. What do we use Zoloft for? Well, it has a lot of indications, but mostly it's used for anxiety and depressive disorders, eating disorders, depression due to cerebral vascular accidents, and a lot of anxiety disorders. It's also used for nighttime eating syndrome, which I just did a video on if you're interested. A couple of days ago, I think it was released. So check that out if you're interested in nighttime eating disorder and see if you might even have it, right? It can be used for non-cardiac chest pain, obsessive compulsive disorders, panic disorder, post-traumatic stress disorders, and even premature ejaculation, believe it or not. What about drug interactions? Well, there's a few that can be pretty severe. You need to worry about non-steroidal anti-inflammatory drugs if you're taking an SSRI. Drugs such as aspirin, ibuprofen, and naproxen. Because when you mix an SSRI with a non-steroidal anti-inflammatory drug, you have an increased risk of bleeding. So make sure to monitor for signs of bleeding. We also know that there's an interaction between SSRIs and some of the opioids. These include codeine, hydrocodone, and tramadol. They did a study which showed that post-operative pain was worse in patients who were treated with SSRIs in addition to these opiates compared with patients who didn't receive an SSRI. Probably the most concerning interaction is serotonin syndrome. You have to be careful when you're taking any SSRI or any antidepressant really with other serotonergic drugs. And some of these drugs you may not think of as serotonergic. Some of the drugs that you might not know that are serotonergic are amphetamines, cocaine, pretty much all of the antidepressants, meperidine, tramadol, pentazocine, even dextromethorphan, which can be found in Robitussin DM, St. John's wort, cyclobenzaprine, buspirone, and Imitrex and the other triptans that we use for migraine headaches. LSD and lithium, among others, are all serotonergic. Now, what are the symptoms of serotonin syndrome? What should you be looking for? Agitation, fever, shivering, sweating, hallucinations, muscle stiffness, loss of coordination, nausea, vomiting, diarrhea, and a fast heart rate. If you have any of these symptoms, please see your doctor or just contact them and let them know what's happening to you. It's also important not to stop SSRIs or SNRIs, or really any antidepressants abruptly because of the risk of discontinuation syndrome. These drugs really should be tapered prior to discontinuation. What are the symptoms of discontinuation syndrome? Well, if you stop your Zoloft or other SSRI abruptly, you might suffer from dizziness, poor muscle control, vertigo, a tingling of your skin, and numbness. You may become lethargic, have a headache, tremor, start sweating, become anorexic, an inability to sleep, nightmares, and the telltale sign of discontinuation syndrome is electric shock-like feelings. Another thing that's important to know about antidepressants in general is you really shouldn't be taking these if you have bipolar disorder before checking with your doctor. And I am going to suggest checking with a psychiatrist before you take any antidepressant if you have bipolar disorder. The reason for this is because SSRIs and other antidepressants can precipitate a manic episode, which may have negative effects. We treat bipolar depression differently than unipolar depression. Before taking Zoloft, be sure to tell your doctor not only if you're bipolar, but also if you have an allergy to aspirin or other food dyes, if you have any type of heart disease, high blood pressure, or if you've had a stroke, if you have liver or kidney disease, seizures, any sexual problems, glaucoma, bleeding problems, or if you take warfarin or other blood thinning medications such as rivaroxaban, apixaban, edoxaban, or Lovenox. So after you begin taking the drug, let your doctor know if you have any changes in sexual function, such as loss of desire or trouble having an orgasm if you're a male. And of course, report any signs of bleeding or an increased incidence of bruising. If you miss a dose of Zoloft, take the next dose as soon as you remember, but don't take 2 doses at once. Drinking alcohol with Zoloft can increase side effects. And avoid driving or other hazardous activities until you know how the Zoloft is going to make you feel and how it affects you. I'm going to end this video by saying that Zoloft is a good drug, and it's widely used because it has fewer side effects and is well tolerated compared to some of the other antidepressants that are available to us. But I still believe it's overused, and I strongly suggest working on coping skills for anxiety and depression before you need them. Remember, even if you're feeling great right now, there will come a time in your life where you will become depressed or anxious or both. As a society, we have a tendency to run to the doctor and expect medications to fix all of our problems. And it's true that there are some conditions that require medications. But there's also others that can be treated by other means, especially psychiatric conditions such as anxiety and depression. If you have any questions about this video, about Zoloft, SSRIs, or any drugs, please feel free to email me at michael.brown@sunshinentc.com. If you know somebody who would benefit from this video, please send it to them. Please give this video a thumbs up and subscribe to this channel for more videos on happy and healthy living. I'm Pharmacist Michael. Please be happy and be healthy.